Welcome back, everyone. We are here today with episode 1864 of the Cabral Concept. If you'd like to read along with our community's questions, head on over to stephencabral.com/1864. So if you are a new listener to the show, I know we've got a few for this new season, or this new year, I should say. There's no season of the podcast. It's every day. But welcome. First of all, welcome. We appreciate you being in this community, organic community. Basically, what we do is we are person to person, meaning that we're really referral based. So if you know someone who's looking to truly figure out the issues that are going on with their health, overall wellness, anti-aging, weight loss, we know that we are able to help them. There's just no doubt about it. And of course, we're not the only ones, but we just know from all the experience that we have that we're able to. But there is a big learning curve in this process, and that is because not everyone is ready to hear that call. Not everyone is ready to actually begin the healing process. And that's why I believe the concept of the Cabral concept is really that you can heal, you can get well, there is an answer, but let's not rush it. Listen to the show, absorb the knowledge that I'm trying to share, that I've been able to accumulate over the past 20 years, traveling all over the world, getting my degree, working in various practices, like all those different things. I've learned from the best, and I'm trying to assimilate that and share that on a daily basis. So that's what we're all about. So again, once again, thank you to new members and old members, not necessarily in age, but that have been around since 2016. Okay, first question is from Selena. Selena says, "Hey there, Dr. Brawl. So I'm just a few days shy of finishing the 21-day detox and just have a question for you. I work straight nights as a nurse, so my schedule is not consistent. For example, I work a few nights, then I have one off, and then work 2 and have 4 off. My body hasn't known what a normal schedule is in 17 years because of my night shift work. Wondering, for the next time I detox, what is the best way to use the detox to get maximum benefit with a schedule like mine, meaning timing of shakes and meals to day to day. Oh, and also, I 100% lost my taste and smell from COVID 6 months ago and have very faintly got them back. I was so hopeful the detox would help with it, but it hasn't. I stay fit through strength training and distance running and have lived a vegan lifestyle for almost 10 years now. I consider myself overall a very healthy person, so I don't get it. Any suggestions? Kind regards, Selena." Okay, first, many podcasts on getting your sense of taste and smell back. Many. Okay, I've done many. So you can go to stephencabral.com/podcasts. And you can even just type in lost smell, lost taste. But essentially, if I cut to the chase, it's not through detoxing. It's through adding back the minerals and nutrients your body has lost, okay? So really important. Daily Foundational Protocol Level 2 or Level 3, as well as the Immunity Protocol. I would highly recommend that. It's worked for so many people in our practice. I use it myself to this day. It's how I got my smell and taste back, mainly my taste. It took 3 weeks. I know it's taken a lot of people a lot of more time, but I was also loaded up with those things the whole time when I had it as well. So again, I do hope that that's helpful. Okay, so let's move on to your other question. When's the best time to do the detox if you have an erratic schedule, we'll say. So 2 things I have to say. And I have to say this from a loving position. But working the night shift is not great for your body, right? You are young, I'm sure, healthy, all those great things. But if you can, get away from that night shift. We know that it's detrimental to the circadian rhythm. Okay, I've said my piece. Now, what do you do, though, while working the night shift on the detox? Well, when you have that 4 days off, that span right there, it is a great time to begin the detox right there, because your 2 fasting days, obviously a little bit more of a challenge, but they also comes the most benefit. And for the other days, and just overall with the functional medicine detox, remember, it can be on any schedule. You're going to have your first shake 1 hour after waking, an hour and a half maximum. That's it. And then every 3.5 hours, you have a shake. That's all there is to it. Listen, let's not overcomplicate this. And again, Selena, I'm not giving you a hard time. I do like to pick on people, but I'm not giving you a hard time. Let's take away the excuses. Whenever you wake up on any day of the week, an hour to an hour and a half later, have your shake. That's it for the detox. Doesn't have to be for your full life, but for the detox. 3.5 hours later, another shake. 3.5 hours later, another shake. 3.5 hours later, another shake. That's it for the day. Now, let's look at it another way. For days 3 through 7, when you're on the meal plan part of it, shake an hour to an hour and a half after you wake up. Vegan lunch, 3.5 hours later. Shake, 3.5 hours later. Paleo or vegan dinner, 3.5 hours later. That's all there is to it, honestly. And that's all you have to do. So basically, you're eating over the course of 12 hours and not eating over the course of 12 hours, all right? So that's that. All right. Selena, hopefully that's helpful. Shelly's up next. Hi, Dr. Cabral. Can you give insight about oral Lichen Planus and how glutathione levels and high oxalate? I have low glutathione levels and high oxalate. I'm using liposomal glutathione, quercetin, and probiotic, L-glutamine, avoiding high oxalate foods, which incidentally, glutathione made severe leg pains that I thought was fibromyalgia go away. I have a lot of recent food sensitivities that make me feel poisoned, wheeze, right eye will swell and become red, brain fog, GI issues. I can't put my finger on what is wrong. I know since childhood I'm allergic to mold and dust mites. Yeah, absolutely. I mean, you, I think, intuitively know what's wrong, but you're not working on it. You're working all around it, right? All around it. Glutathione, well, you're using that to ramp up your detox. You're taking quercetin, most likely as a zinc ionophore, but probably more of as like an antihistamine. You're taking a probiotic, probably because you know there's some gut issues there, and L-glutamine, most likely for cellular regeneration. Okay, so, and for gut healing. Okay, all of that's good. However, as someone who's dealt with a lot of these issues, yours is most likely yeast and mold related. That's the bottom line. Now, again, I know that functional medicine testing is not accessible to everyone, but I'll tell you this right now. This is for Shelly. If you ran only one lab, you'd run the Candida metabolic and vitamins test. You would probably find high yeast and high mold. You could also run the mold test along with it. If you run those, you're going to get all the education around it. You're going to even look at your glutathione levels, and then you're going to get the plan to go along with it. I mean, like, that is what I recommend. Although I love glutathione, I love quercetin, I love probiotics, I love glutamine, they're not doing anything. They're not doing anything to get to the root cause. You're adding more when we need the other half of the rain barrel effect, what I wrote about in my book, The Rain Barrel Effect. You need the subtractive properties, which is what I learned overseas. They don't teach this in the West, in the Western-based world. They teach it over in India, China, and other places. You need to remove. You have yeast overgrowth, most likely, mold overgrowth, most likely. We can lab test those and find out. You can go to equa.life/labs to grab those labs. All right, and then that will make you whole again. It really will. All right, Helen's up next. Hi, Doc. What are your thoughts on Streptococcus? I've seen great probiotics out there with mainly small intestinal strains, Lactobacillus, but I see Streptococcus in almost all of them. Do you think we shouldn't buy those that contain Streptococcus or are still beneficial? I'd love to buy your products, but taxes are too high in the UK, so I try to find similar ones, so I'm trying my best. Thanks. Okay. Good question. Taxes are taxes. We don't have anything to do with that. That's the truth. Is like your country taxes us. We tax other countries. It's all about tax, right? Tax the citizens, take away their money, and that's that. But anyway, taxes are taxes. We all have to pay them. So Lactobacillus, yes, we do want that. That's the main. We want the main strains of Lactobacillus: Plantarum, Reuteri. I mean, I could go down the entire list. Acidophilus. You want those lactobacillus-based strains because that small intestine has to stay populated with the lactobacilli-based strains so that you don't end up with small intestinal bacterial overgrowth, SIBO, right? Okay. So what about Streptococcus? Well, we don't use a lot of Streptococcus in our practice, that's for sure. We will use Streptococcus for sometimes recurrent ear, nose, throat issues. We will use Streptococcus, which is not ongoing, but we might use it for 30 to 60 days in like an ENT-based probiotic. That's specialty. We would have to be working with the person specifically. I recommend the daily probiotic support is what you're looking for. Okay. Emma's up next. Hello, Dr. Cabral. I started listening to your podcast about a month ago, and I love them. I'm writing to you today for guidance on fat loss and tendonitis. Well, let's see what tendonitis is. Usually I don't look things up while I'm on the podcast, but you've caught my attention. Expressing or intending to promote a particular cause or point of view, especially a controversial one. Tendentious. All right, tendentious. I learned a new word. I love to learn new things, and that's my new word. I'd love to learn guidance on fat loss and tendinitis, expressing or promoting particular cause or case. I don't know the use there, but I'm working it out as we're going through the question, but I, of course, can help you with fat loss here. So let's go through the rest of your question. A year ago, I was diagnosed with posterior tibial tendonitis in my left foot due to overuse. I ran 3 marathons in a year. Over the last year, I've tried PT and injections, but nothing is working. I've gained 10 pounds over the last year and a petite 5'2" woman, so the weight gain is noticeable and annoying. Do you have any recommendations for losing fat with little to no exercise, specifically around the midsection? I purchased your 14-day detox protocol, and I'm hoping to jumpstart the fat loss. Any tips would be appreciated, and I want my pants to fit again. Thank you for all you do, Emma. Emma, welcome to the community. Thank you for joining us. Truly appreciate you. And I'm happy to help with all of this. And instead of tendonitis, your word expression, your word correction, changed it to tenditious, unless I'm misreading this. So I get to learn a new word, but really what you were writing was posterior tibial tendonitis, not the expression of something, a controversial point. So for sure, posterior tibial tendonitis, happy to help with that. So really we're looking at you get your basically around the shins, the shin splint based area. And you got that from overuse with running. Totally understand. And what happened was now you're not able to run. So you're not burning those calories, not as metabolic, which means you gain some weight. Okay, so how do we fix this? Well, there's a couple things we have to do. First of all, you can fix tendonitis, and it is a pain when it's posterior tibial tendonitis. But what you need to do is work with a good muscular therapist, somebody to elongate and work with the anterior tibia as well as the posterior, work on ankle mobility. So a lot of drills there. And then you'll turn your mindset right now to resistance-based training along with bike sprints. And honestly, you'll be totally fine with that. Like your tibia should be fine. I can't give you medical advice. If you were told by a physician to not do anything, then I understand, but it doesn't really make any sense because certainly you can stand and you can do standing-based exercises. You could do squat presses. You could do all sorts of great things to get very metabolic. And you could do 4 or 5 bike sprints. Like for sure you can do that. So that's what I recommend. Definitely the 14-day detox, and then maintain with something like the daily foundational protocol plus Fatlocity, because Fatlocity is clinically proven to amp up your fat loss. Clinically proven, 25 clinical studies showing you that you will burn more fat with this 24-hour formula. Now, don't just use that. Use the good nutrition, the good exercise as well. Great question, Emma. Stephanie's up next. Good morning, doctor. Thank you so much for taking the time to answer these questions. We all appreciate them a lot. Thank you, Stephanie. I know you've answered a lot of questions when it comes to hormone replacement therapy, but I wanted to ask you specifically for your opinion on it. Do you think that after a woman reaches menopause, there is only so much she can do through the de-stress protocol, and so hormone replacement therapy is sometimes necessary? Or do you think that you can always fix it naturally and there is never a need of it? Great question. So you're right. I've talked about hormones a lot. I've got a deep dive on all about female hormone balance as a teenage 20-something-year-old woman, as a 30, 40-something-year-old woman, as well as a post-menopausal woman. That is all at stevencabral.com/courses. And you can click on the female hormone rebalancing course. And that will teach you everything that you need to know, like literally A to Z. However, I'll just answer this one specific topic because you do need to look at your body and what's holding you back. There's no doubt about it. You will still produce hormones after menopause, albeit not as much. However, before we ever think about estrogen replacement, progesterone replacement, testosterone replacement, which is like last resort, I recommend, again, getting your body healthy. Do the big 5 labs. Heal that body, reduce inflammation, balance blood sugar, all those things first, okay? Next, though, after you've rebalanced the body based on the big 5 labs, you'll use your daily foundational protocol. You maybe use the immunity protocol, and you might use extra magnesium or CalMag, especially postmenopausal, and you'll most likely use DHEA. Now, DHEA is dihydroepiandrosterone, which is we'll call it a prohormone. It's a precursor to testosterone and estrogen, and it will help balance out progesterone and cortisol as well. It's always where we start. It's what I will use when I'm, let's say, 60, 65 plus. And again, based on my labs. And then it's what I'll recommend for my wife as well. So that's what I recommend, and that's what I'll recommend. And and then again, is there a time and place for estrogen, progesterone, testosterone for women? Questionable for testosterone, very questionable. A tri-estrogen blend or estriol, maybe, small amount. And progesterone, potentially, yes. But again, you have to work the process first. That's like the very last step, only if needed. And I'm not a big advocate of hormone replacement therapy. And when needed, very small amounts, not these mega dosage that a lot of doctors like to use. All right, we've got one more question today. It's from Colin. Hey, Doc. Hopefully by now I'm a repeat question asker on the podcast. Sent you one a few weeks back about weightlifting and inflammation. Your podcast 1817 about male hormones today got me thinking about something else. I've currently been taking finasteride, which, by the way, is Propecia for those people that don't know out there, for hair loss. And for most part, it seems to have staved off further thinning. I'm a guy in my 30s. This is the last thing I'm going to give up without a fight. What are your opinions on extended use of a drug like finasteride? That's basically stopping the body from converting testosterone into virtually useless and damaging hormone in adult men, which is DHT, which is good. You've done your homework, Colin. I've heard of some upcoming topical anti-androgens coming to the market that would potentially be even more localized to the scalp. It would inflict less systemic effects like an oral drug. Thoughts on any of this? I'm torn on natural remedies to hair loss because by and large, they've been proven to give little to no effect on hair loss. In fact, why would we consult nature on a natural process trying to destroy our hair? I do think, however, that there may be some natural assistance we can provide our bodies to deal with extended use of a drug like finasteride. In any case, love to hear your thoughts. Thanks so much for putting out your content. Colin, it's a great question. Believe it or not, I haven't talked about this yet, and I'm saving it for a full podcast. You can see the back of my head now, full hair. My hair was thinning on the back of my head, which is male pattern baldness. I haven't even talked about this before, about a year and a half, 2 years ago. And I didn't even know it because I honestly don't pay a whole lot of attention to my hair. Certainly don't look at the back of my head. And I probably had to count on the number of times on my hand, how many times I've seen the back of my head. But I saw a photo and I'm like, whoa, like what's going on here? My hair's thinning in the back? I had no idea. Took a photo of the top of my head. I was like, whoa. I really am. My hair is thinning in the back of my head. So it regrew, which I'm very happy about. And I did what I've been telling men for many years. And that is you use the advanced prostate support. So I'm not going to go through in depth right now, but basically I wasn't eating enough protein. That's one. I was definitely converting more testosterone to DHT because I have higher levels of testosterone, typically 130, 140 on a stress hormones mood and metabolism test. And for some of my age, 100 would be good. And all sorts of different factors. Okay, I won't go through every single one. But the advanced prostate support is a DHT blocker. It's a natural DHT blocker. So what you might want to do, Colin, is use the advanced prostate support instead of the finasteride or a smaller dose of finasteride and the advanced prostate support. And then I'll go through the other things that I did as well. Some men choose to use, what's the name of the product? Minoxidil, because I believe that's a DHT blocker on the scalp. So, there's things you could do. Like you might use the advanced prostate support. We're going to rename it for hair in the future as well, because people obviously, it works for women that have a DHT issue, which is much more rare for women. And then they choose just to use some minoxidil on the top of the head. Again, there's lots of other things. I did scalp massage with sesame oil. Again, there's lots of things that you can do. PRP works for some people. But let's talk about your question. Your question was, hair loss. Yes, it absolutely happens in more pitta-based men. They convert more testosterone to dihydrotestosterone, which can affect the prostate, which is why we use it for advanced prostate support. And of course, it can cause hair loss. So what are the side effects, though, of finasteride? Well, some men end up having, there doesn't seem to be huge long-term side effects that I've seen. I have not seen huge long-term side effects. However, I have seen it affect mood, lower mood. I have seen it affect actual testosterone levels. And even though it's not supposed to, I've seen levels go down slightly or moderately to slightly. I have seen that. Again, I can't say that's for everyone. And also, there can be erectile dysfunction-based issues. Now, if you don't have any of those, then the drug might not be affecting you in that way. If you can do it naturally, then of course, we recommend it naturally, which is the route that I decided to go. It doesn't mean that it's for everyone. It's simply the route that I decided to go. So, Colin, hopefully that was helpful. And once again, thank you for tuning in. Thank you for being a repeat question asker. And that is our show for today. These shows really do fly by. So, of course, if it was helpful, please do feel free to share this show with anyone you believe it could serve. And don't forget to tune back in tomorrow for the best way to start your week with our Mindset and Motivation Mondays. Take care, everyone.